On September 7th, I spent the afternoon and then the night in an emergency room. I finally just got the bill. $18,152.05. There's a phone number where you can call and ask questions about your bill, and I think I'm going to do that now. The staff at the hospital were wonderful to me, and I feel I received excellent care. And because I have insurance, I will not be paying this gargantuan bill. But something is definitely screwed up here. Not only do I wonder about the extreme costs the hospital charges for its products and services, but the amount of procedures I was put through seems very excessive. I am not a spring chicken and take various medicines for my craziness, borderline cholesterol, and a case of low-tension glaucoma in the right eye. A few weeks before my 60th birthday, I started having recurring pains in the upper right side of my chest and sometimes in my back. After a couple weeks of this, I visited my primary care doctor. I told him that I had been cutting back on the cholesterol med because I had read there was a link between these drugs and diabetes. I told him the pain was not affected in any way by my daily 3.5-mile jog, so I figured it couldn't be my heart. His secretary gave me an EKG on an ancient machine, and when it had a slight irregularity, he ordered me to the ER for a second EKG and a heart enzyme test. If the ER had done just that, I would have been out of there very quickly. I'm still on hold. Some of the costs of these procedures seem a little bit out of whack. I went online to see how much it should cost, and but the ER doc ordered a CT scan. This showed a slight blip that was very likely what is known as a motion artifact. But there was a tiny chance it could have been a pulmonary embolism or clot in my lung. There was nothing in my lifestyle that indicated that this was likely. No 18-hour plane flight without me walking around, or other likely causes of an embolism in a middle-aged man. But this blip on the CT scan launched all manner of other tests and medicines, plus a sleepless overnight stay. I got what's known as a D-dimer test, which was negative. I'm not a doctor, but I found out online that a negative D-dimer test will virtually rule out a blood clot. Nevertheless, I ended up having a VQ scan, which involves sucking in radioactive isotopes and then having my lungs filmed. This in addition to the CT scan and 3 chest x-rays. Was all of this necessary? A result perhaps of defensive medicine? Or was it at least partially a profit-generating activity? Yes, my name is John Thornton. My account number is 400. I got the bill, and I know I owe you my copay for my insurance, but I was looking at the services provided and the amounts that are being charged, and I just couldn't believe how expensive it is. Is there anyone I could go over the bill with? That may be that they're similar to the charges that other hospitals in the area would charge, but they're so inflated. Can I just give you a couple examples? The first item, that surgery telemetry observation 1 hour, you're charging $3,515, and online it said it's $1,300. The next one, the eye drops, I had one eye drop charged for $49. The unit cost is $3.57. This fondaparinux sodium. Now this is truly astonishing to me. You're billing $2,173, And online, it's $43. How do you justify that? It's like robbery. I don't know how you can get away with it. And there were other examples of grotesque markup that I found with just a few minutes on Google. The national average cost of a CT scan is $1,800, and yet mine cost $4,075. The cost of a cardiac profile called POC troponin 1 was $15.40, but I was charged $250 plus $355 for the troponin itself. And I was given a few antacid tablets, a generic version of Protonix called pantoprazole sodium. I was billed $242. Online, I found it for 82 cents a pill. The irony is that this is what my problem was. As I suspected and had told the ER docs when I first arrived, I thought I was suffering from GERD, or acid reflux, which bedevils millions of Americans of my vintage. And that's what I had. The customer service rep was very nice, listening to my outrage, and said she would pass my information along and have the bill placed under review. Now you may be shaking your head and thinking, this guy only has to pay a $75 copay and he got to have all these wonderful tests and got a relatively clean bill of health. And for a neurotic guy like him, peace of mind is a wonderful gift. What's he complaining about? Okay, so maybe it doesn't affect me personally. I have health insurance. But what about people who don't? What about people who can't afford health insurance? They're not going to be able to pay these bills. It's ludicrous. I'm not mentioning the hospital that I went to because I think this is a problem that transcends individual hospitals. My sister told me about a 60 Minutes episode she saw the other night in which hospital administrators were putting immense pressure on doctors to improve the profit margin. I don't know if that's what's going on with the hospital that I went to, but you have to wonder. I just think there's something seriously wrong with our healthcare system. Peter Arno, the great American cartoonist, once wrote a book, Hell of a Way to Run a Railroad. And in my opinion, this is a hell of a way to run a healthcare system.